It is. There we go.
Alrighty, we're now recording. So I wanted to thank everybody for taking the time today to presentation of the Homeless Data Integration Project, the information in Q&A. I want to introduce myself. I am Andrea Ukrop, and I am the Homeless Data Integration Project Coordinator. Elena Sigsby is with me. Elena, if you could wave, thank you. Elena is the Homeless Data Integration Project Specialist. I have Ian Kozak from Green River, which is our vendor, and Sarah Ryder from Green River, again, our vendor. Let me do a couple of housekeeping things before I forget. Please put questions in the chat throughout the presentation. At the end of the session that I'm going to go through, we'll open it up to questions, and Elena will be fielding questions along the way. And then again, we'll leave plenty of time for questions at the end. So I want to take us back to 2019, and I was sitting in a National Human Service Data Consortium conference, which some of you may know as the HMIS conference. And there was a lunch presentation, and staff from HUD posted these 7 predictions about the future of homeless services. And I was sitting there listening like, oh, we got a lot of work to do. But not long after that, kind of our project took off. And kind of all these things that HUD has predictions for are things that the HDIP, as we lovingly call the Homeless Data Integration Project, will be able to help us as a state as well as COCs do. So we will be able to be more strategic. The tools will be advanced. The data demands, we're going to continue to create complexities. The privacy challenges won't go away, but we're working really hard to make as many choices and preferences available. There will be close to real insights that are possible. Those hopefully will grow over a period of time as to how real time, quote unquote, that they will be. Staffing capacity will expand. I mean, just like my position was a new position around integrating homeless data, so we at DHCD are needing to expand as well, and communities will need to rely on actionable data to make decisions. And today we're going to go over several things to help everybody have a better understanding of what the HDIP is, kind of reasons for the development of the HDIP. A lot of them have to do with those predictions about having an understanding of the clients of our communities to be able to make decisions based on data. We'll also talk about the history, the governance, the advisors, and the vendor for this project. Ian will be able to show us some screenshots and some use cases. And then I'll also talk briefly about the draft documents and the consent structure that we have in place. And then we'll just talk about where we are with next steps. So the Homeless Data Integration Project is an analytic data warehouse. It sits on Green River's OpenPath platform. But here on out, you'll hear us call it the HDIP. But what it does is it's able to combine, collect data to put it in the aggregate, and that it is creates a unified client record. So if a client has been served over multiple COCs, there's a way to be able to see that information about the client. Also, all of the HUD reports that many of you may have to produce are also available in here, where you may want to do some comparisons with your HMIS. And especially, I feel like there's some significant support with the LSA and that Ian's going to talk about a report that can show some data quality issues that may come up that you could correct before submitting that. And I think that's about all I have to say at this point. All right, so how we got here. So I started at DHCD back in 2014, and I was the COC, Balance of State COC program coordinator. And under that, data, because we had HMIS, fell under me. And so there started to be conversations about having a statewide HMIS system. If you guys were here then, you may remember those during their input sessions. So for a couple of years, we put forth a request to the General Assembly to pay for that system. Along the way, we were also starting to hear more concerns from COCs about what that would look like for them. And after it wasn't funded for 2 years, and we heard COCs as well, so it didn't seem like something that we should continue pressing, we moved on to some other opportunities. Homeward was doing a pilot project of their own, using a TA provider, and they were doing some work in Tableau. If you were around probably in like 17, you may have seen 17, 18, somewhere around there. During our presentations before the Governor's Housing Conference, you may have seen some of those Tableau dashboards. Our TA was finishing up, and we still weren't really in a place that we wanted to be. And we were working with Green River at that time, and they introduced us to their OpenPath software. And since then, we have had a pilot project going on with, I believe it's actually 7 of the COCs, those that work with Homeward, and those that work with the Planning Council. About a year and a half ago, there was the development of an advisory board, and we're going to talk a little bit more about the role of that board. We were finally, after over a year, able to procure Green River. So that is procured through VITA, which is the Virginia Information Technology Agency. So it wasn't just DHCD looking at all the security practices and things that IT people know about that I don't know about, but it was our state IT agency from which they're procured. We have developed a governance structure that I'll talk a little bit more about, and we also have a steering committee that I will share their role. All right, so the advisory council is made up of HMIS leads across the COCs, and they have for about a year and a half been providing guidance and expertise in how HMIS works in their COC and how we can limit the number of barriers and increase the use of the HDIP system for COCs once we go and move into implementation. This group is also helping with policies and procedures and needs for training. I just want to recognize all of the advisory council members. And we will have 2 new members who have been invited, Sarah Fuentes in Lynchburg and Anton Overby in the Western COCs. It has taken some time to get all the COCs as advisory council members. I was very naive about the way communication worked among COCs in the beginning, and have gradually added people on along the way. And I think everybody, for the information and all that they've given towards this project. Next slide. All right, the steering committee. So our project is funded through HMIS funding, and so therefore we got to be in compliance with HMIS regs. And part of that is having a governing body to serve as a decision-making and guidance body. So we created that this spring. They've met a couple of times. There are two specific areas are compliance and performance. One of the things that we want to make sure is that we are definitely in compliant with all security standards, data sharing opportunities, all that fun stuff. And then also that we work to create the processes and workflows and data sharing systems to be able to use the full potential of this platform. And Ian's going to talk a little bit more about that, but it gets, it's great for data analysis, but what we can do down the road, once we have the staffing capacity at DHC to get there and we're all implemented, is for care coordination among service providers and case managers. So I want to recognize all of the members of the steering committee and let you know what the written governance is for the members of the steering committee. So there are at least 2 people with lived experience, and then there's state agency representation to include the state data officer, Department of Housing and Community Development, Department of Behavioral Health and Developmental Services, Department of Social Services, Department of Medical Assistance Services, which is DMAS and Medicaid. And then there are 4 positions representing continuum of cares, and that is an HMIS administrator, a COC lead, a participating member, which would be an organization that is part of the HDIP system, and then somebody with supervisory or direct care staff. And then we have 2 positions for other interested stakeholders. And currently we have Adele McClure from the Virginia Legislative Black Caucus and Matt Leslie from Department of Veteran Services. I'm going to talk some about the draft documents, and we can bring these back up a little bit later when you see some of the slides that Ian shows. As I said, we do have a governance structure, and it is based off of the HMIS requirements of what needs to go into that system. We also have created the COC data sharing agreements and what the roles and responsibilities are for the COCs and DHCD. Additionally, each organization within a COC will be required to submit a participation agreement should they participate. Right now, we're working to get everybody to participate based on seeing the usefulness of the system and understanding why it's important to have statewide data about the homeless services system. There's a user agreement, which is about the security protocols that all users will need to enforce. And then the client consent process, which the process that Ian is going to go through around client records is currently the way our consent process is written. So that'll make a lot more sense once Ian starts his portion of the presentation. And I believe I'm turning it over to you, Ian.
Yeah. Were there any specific
questions, please.
Before we sort of launch into the...
I understand that was a lot of information that's kind of hard to take in before you see the system, but I'm happy to take any questions.
All right. Well, I guess silence is golden. So as Andrea mentioned, the HDIP is based upon an existing platform that we at Green River have been the developer for. It is software that really has been created through a joint investment and collaboration of communities. It's at its heart, it's software that is designed to integrate multiple data sets for both care coordination and then a whole spectrum of analysis and reporting. It really focused in its early days on HMIS data, and for this project, it's going to be almost exclusively HMIS data to begin with. But as we've been developing it and different communities and organizations are using it, we're beginning to use it also as a foundation for other types of integration. So we have installations that bring in medical records, say Medicaid claims history or electronic health records or criminal justice records, again, to be able to use sort of an existing platform to build out a larger integration tool. The project itself started with the city of Boston 6.5 years ago. Their vision was always to try to create a shared technology resource that other folks could take advantage of. To that end, it's open source. So that, licensing wise, what that means is the software itself is free. We don't make money off of licensing. We don't care the number of users involved. We host it, we manage it, we support it, but the software itself is in the open source and anyone can adopt it. Practically, what that means is every community contributes to it in some way. So there are features, there are workflows, there are reports, there are different kinds of data sharing models that all the communities that have used the software have asked us to build in. And then it's actually part of the licensing model that becomes available to everyone. So anything that gets developed for software for anybody using it is by law really then available to everyone. So at this point beyond Boston, I think we have 6 COCs and 4-5 statewide implementations, similar to Virginia. But all those different organizations kind of use the platform in a subtly different way. And so it creates, again, this kind of larger tool that is versatile, that can be used in a bunch of different ways. Its origin was about tools for providers on the ground. It really was about doing integrated care across data sets. But to do that effectively, it also needed all the components for data warehousing. So what has evolved is a pretty mature system that does all of the warehousing, the analysis, the aggregate reporting, but also can serve up specific needs for different parts, different levels of organization. So the project level analysis, client data, either with identified information or without, you can sort of do aggregated client data. And then, as Andrea was saying, kind of potentially very usefully for the HDIP is integrated care, kind of to bring folks together from the provider level, case managers, around individuals. The idea behind the HDIP, and I think Andrea spoke to this quite a bit, was providing value to essentially lots of different organizations, lots of different stakeholders across the state. One obvious beneficiary and sort of the organization driving the project is the state, is DHCD. The state has never had access to that uniform deduplicated data set before. Their role within the HDIP is not ever to look at client records. It's always to look at aggregated reporting. But until now, the only sort of thing that someone at a state level could look at was PIT counts and sort of the per COC based numbers. So by bringing everything together, you can begin to piece together stories of vulnerability, of service pathways, of histories and utilization that really was dark before. Yes, there was some visibility within the COC. There's the planning council regions, and then nothing really before at the state. So this is an example screenshot of a public report that we have put together for another state implementation, doing the sort of things you would expect, like looking at a homeless population, looking at sheltered versus unsheltered, looking at the different subpopulations, getting at a bit of vulnerability perhaps overall. So actually calculating chronicity per HUD at a statewide population level. And then because it's a data warehouse and we can bring in other data sets, it's very easy to do some equity analysis. So this little bar chart here on the left is showing the homeless population versus the overall population. So comparing census data, which we can pull from the census data API for a particular area or region compared to those homeless. or receiving homeless services. But the idea was not just to serve the state. It was always to try to provide value at each level, from COC to organization to provider. So one piece that has always been involved, one group that's always been involved, is a COC lead, sort of the agency level. There's lots of stuff that a COC already can or probably should be able to do within their HMIS. But over time, as different communities have used this platform, we've built reports to essentially augment HMIS. Things that are difficult to do within existing reporting frameworks, things that were difficult perhaps to distribute, or just easier for us to build and say, hey, here's a canned interactive report. It also, of course, allows you potentially to look at performance comparisons from a local level against the state as a whole. Though it's always been part of the conversation not to have a COC be able to analyze another COC's data. It's not, look at somebody else. It's mostly look at your own being your COC's data in the larger context. So there are lots and lots of reports built in. I mean, one quick example here is a rapid rehousing outcomes dashboard. So for a given date range, for a given time, for a given universe of clients that you can define, what does rapid performance look like? And this can be run at a COC level or even down to an organization or project level. And this is an example of a lot of sort of canned reports that are there. So time in pre-placement, time after move-in, outcomes over time once folks have been in rapid. There are lots of reports that you can run against the data set, again, that is just HMIS data, but often is a little easier to do in the HDIP. One critical piece that folks have latched onto is almost every report you can run, you can limit the universe, to use HUD's term, of clients that you're looking at by demographics. So you can start to limit the analysis set by age, by race, by ethnicity. And then if you're running the report for your own data, for your own COC, you can then drill down into the results all the way potentially to the client level to figure out where those numbers are coming from. Again, no one at DHCD would do that. No one from another COC would do it to your data. But if you already have access to the data within your HMIS, here's an additional analysis tool set for the identified. Kind of similarly, you think of a HMIS admin, of a lead organization and a person. Very often what we hear challenges around those on the ground responsible for HMIS comes back to data quality, comes back to tracking performance. There are lots of pieces in place for drilling down in particular types of data sets. So doing length of time here, prior living situation analysis, things that can be limited, again, to different levels, to organization, to project. But then also focus on data quality, things that HUD obviously cares about, if you think of the SPMs and the data quality reports and even the LSA, but often aren't that accessible to an HMIS admin who's trying to build up a continuous improvement process with projects to try to get folks involved really in a process. So this is an example of a very, very light, simple scorecard for a given project. What are the quality elements? And there's a threshold you can set across the system of goals. But the idea is this project doing well or not in terms of data quality? There are also more detailed, nuanced data quality reports that can be run for organizations regularly or projects regularly. They can actually be run for individual projects or project groups that can go out to folks who are responsible for that. So this is a screenshot of bed utilization, sort of a typical data quality piece of what is your utilization like, and then an example of maybe what data completeness would look like. And you probably can't read those x-axes, they're tiny, but it's looking at income at entry, destination, prior living situation, gender, date of birth, overall timeliness of data entry. Those core HUD HUD data quality elements, but at the project level. And as Andrea also mentioned, there are of the full HUD reports in there. Probably nothing that would be that useful, because you should have all of these within your HMIS. What they do allow you to do is run the reports against a particular population. So you can run it, all of them, against a particular age group or demographic set. You can also always drill down on the results to find the individual clients behind that report. And then there are some guiding data quality bits, like here for the LSA, to try to anticipate what data quality flags you'd have. A lot of HMISs do all of this, but there have been users of the system who've struggled with their HMISs or required some level of data integration to do these, which is why they're already in the platform. And then at an organization level, all the things that we just talked about, from DHCD's level all the way down, someone within an organization or a particular program agency could do. Things that either can come again in aggregate or with the data set available, potentially to drill down on details. So this is an example of a pretty detailed outflow report for a given date range for a population you define. Where are folks leaving? What does that outflow from the system look like, broken down? And once again, all of the demographic definitions. So if you want to start applying this sort of thing against a racial or ethnic analysis, you can do already within the filter criteria. And then you sort of get to arguably the ultimate use of this. If you think about the value of the HDIP, I always see it in two places. One is that large state level data set, kind of DHCD's policy analysis role, because again, never before was the data from the whole state available in one deduplicated set. Great. Then there's a bunch of value added pieces for COCs. But as I keep saying, a lot of that is using HMIS data that potentially already have within your HMIS system. But the other thing the HDIP can allow you to do is to really come together to do shared data, to do an integrated care for an individual, to do that care coordination, to be able to see for a person what their history is, what their overall vulnerability is, things that may be in their history and who they've worked with and where they've been that wasn't available to you before. And then at a case management level, potentially use that information to tailor service, to tailor an intervention to recognize someone. So there is a lot of tooling already in the HDIP around that. And there's been a lot of discussion in the advisory council and all of the board here. It's not a board, it's a committee, to evaluate how that works and what the data sharing model is and what's visible to whom. This is kind of phase B of the project. I mean, phase A was always to bring in the data first, get it in there, be able to do that statewide analysis, allow COCs in there to explore their own data. But having the care coordination kind of on the roadmap, we collectively thought was really important because, again, the value of the system comes out of that. So one thing we settled on quite easily was being able to look at aggregated individual client data. So if you're working with a client that's in a COC, in a provider's office, you could look up their history and just see an aggregated result of what they've experienced. So you sort of think of it as a vulnerability roll-up. How long have they been in? How long have they been homeless? How long have they been in shelter or homeless services? And then beyond that, beyond sort of getting a snapshot of vulnerability, potentially see where they've been, what actual enrollments they've seen. So this is obviously fake data from a demo server, but these little blue lozenges on the left all say ES. So these are representing emergency shelter enrollments. They would also include any homeless services that came through within HMIS. So you would get transitional housing, safe haven, street outreach, other services, prevention, coordinated entry, anything that's in there could be built out and displayed as someone's history. The platform itself then puts that in a unified client record. So overall days homeless, that vulnerability indication then can take into account someone's full enrollment history. This little green bar at the bottom is an indicator of a HUD episode. So begin to create the definition of episodes across the multiple enrollment sources. And again, be able to look essentially since the beginning of time at where someone has been. So one obvious piece here, or something I wanted to call out, is there's this project marked confidential. That doesn't say the project name, that doesn't say the organization, doesn't say the COC. This is to allow a COC, so somewhere along the line, if a data sharing agreement or a project didn't share its data by default across the population, to hide it. So the COC admin, the HMIS person who is uploading the data, can mark whichever projects need be or whichever organizations need be hidden. And those get incorporated in the data, but then are not visible to someone looking at the client record. We then decided to say, okay, that's there, those things are hidden, but then give the client the agency to say, okay, it's okay to look at that. I agree to share that information through a very explicit release process. So within the HDIP, someone could get a release, have the client sign it, and upload it, which would then open up that visibility of someone's history. So the client agrees to share the information. It's a limited release by default, so after a year or so, it will lapse. And then once that release is in place, that full history is available. The client could also revoke it at any time through anyone within the system, so they could immediately pull off the release, which just closes down that access. So that's kind of a very high-level whirlwind orientation of sort of the platform and the kind of the setup and configuration that we landed on over the last few months working with folks. I can answer questions, or Andrea, if you sort of want to wrap up, I know there's some very specific things you wanted to talk about here.
Yeah, I can go through these quickly and then we'll save the rest of the time. We'll have plenty of time for questions. So one of the things that is super important to us is making sure people have the trainings and technical assistance that they need. So there will definitely be orientation trainings that will be done. And right now we are drafting workflows and some procedures that Elena is working on. And we are running those through some members that are part of the pilot project to see if when they follow those instructions or those workflows, if what we expect to happens to make sure we're getting all the steps in there. So things that would be of greater importance, we'll work with the advisory committee, and then there'll be trainings for orientation on those matters. Second, for technical assistance, right? Like we're really working at this from a place of equity. So DHCD is giving everybody the same access to the same tools, right? Which is great, but we also want to make sure that COCs have the ability to equally use those tools. Right now, we know we have some COCs with some really high capacity that may even feel like by giving us their data, they're giving us more than they feel like they are going to be able to get from this because they have high capacity to do HMIS analysis. And then, we have COCs and local planning groups that really struggle, don't have the staffing capacity to be able to do some of the basic things that are expectations, but we also understand that the capacity is not there. So there might be places where somebody's a case manager, they are the person responsible for HMIS, and sometimes they do coordinated entry. So, which is, obviously a lot. And so we want to have some assessments from a technical assistance provider to where we can do some cohorts of training so that people and the COCs will have access to these tools and be able to use them. And then we are hoping to hire the part-time position on as a full-time position, and that is going to provide somebody who has expertise in the OpenPath system in the HDIP. Right now, that's Elena, is going to be the ongoing support and all things workflow and procedure-wise. And so there'll always be, we'll put in place kind of that help desk, frequently asked questions, those things that people will be able to access on a regular basis. So those are some things that we have forthcoming as soon as I finish working with Pam and the Office of Attorney General on getting the agreements approved to be able to go out. They are in draft form. We can send those out in draft form. There will be huge draft and not approved watermarks on them, but you can request those from myself or Elena. We'll make sure you get copies to review. This presentation, since it is being recorded, it will also go out probably sometime next week to everybody who registered. So those who weren't able to attend, you can either forward it if they weren't registered, but we want to get this information out so that when we're ready to go to the full implementation stage, COCs have already been talking about this and figuring out ways in which they will be able to implement the project. And now I'm going to stop and open it up for questions. Please ask. You can do it through the chat or unmute yourself.
And we must have talked really fast.
We must have, because we're 5 minutes early today. Did we miss something? It was probably just because it was being recorded. I know with this region, there's been some people who have been in there. So if you guys have any thoughts about your early uses, that would be awesome too.
I guess it's all good.
I guess so. We won't hold people. I will stick around. And I'll ask Ian to stick around for just a couple minutes in case there's questions. But if you don't have any questions, I want to honor your time. So the anticipated rollout schedule kind of all depends on when we get final approval for the agreements. There, you can imagine with state bureaucracy and also working with lawyers, that can be a tedious process to go through. But the timeline, I feel, will roll pretty quickly. After that, everything will go to the steering committee for final approval. And then we'll be identifying COCs. I think we've talked about 2 coming on at a time. And we'll start with the ones that are in there, getting everything updated document-wise. And while that's going on, we can start implementing with others. I'm glad that you think it's awesome and exciting. The slides should be available. We'll just do it, probably send out Monday or Tuesday of next week. Something like that. Taylor's recording it, so we'll just have to work to make sure it gets to the right people. Thanks, Taylor. Also, you have here my contact information and Elena's contact information. So anytime if you want to discuss this further, we will make ourselves available. Additionally, if you have questions after you review this further or have conversations within your COCs, please reach out and we will make ourselves available. This is a priority for us to get done. Is there any overlap with similar reports in HDX on the LSA? That I can't answer. Ian, are you able to?
There is some. We have not tried to duplicate the full HDX LSA-based reporting. There are ones that are similar, though, in the HDIP, the idea being that you can drill down and find the actual data behind it. It's funny because the whole initiative behind all of the LSA reporting was supposed to be able to give you access and sort of a visualization of service pathways and things. So I guess the answer is it's very similar, but not exactly. It is not Stella recreated, if that was the gist of the question.
Yeah, and one of the things that's really exciting about this is that you get a deduplicated set, and you're able to see the pathways across COCs. So the coordinated entry will be a project in the HDIP, and it'll show up as such. It's also something that if you want to not include coordinated entry information in something that you're doing, or just look at coordinated entry information, you would be able to do. And I don't know, Ian, if you want to discuss other ways that it's incorporated.
Yeah, I mean, only that there are lots of other communities looking at now building out coordinated entry performance reporting to try to get at what's going on. So ideally, that coordinated entry project enrollments and whatever is in the core HMIS CSV export, which would include the assessment details, would come over into the HDIP. How that then is used or available for reporting is still evolving. But like I said, it's on lots of communities' mind now to begin to really look at the coordinated entry process. So it is part of the HDIP.
And I would say as DHCD, so one of the things that any reports that DHCD will require will be built in the HDIP if they're not there already. And so you would be able to take that information and then input it into CAMS. This is not going to replace CAMS because CAMS gets integrated with a bunch of other stuff. But we are having conversations about what we want the reports regarding coordinated entry to be showing us, because we know what we're getting right now is not particularly useful, and probably isn't, if you're following HUD guidance for coordinated entry, probably not particularly easy to capture, which we are aware of that. So until we make some decisions internally, then just do the best you can with those. But soon everything will be in the HDIP once it's implemented. One of the other things I'll just say shortly is our funding to help cover any additional staffing needs. So this is at no cost to you, and will hopefully make your work potentially easier. There is, some time for uploading and for using it, but I don't know. I don't know if there's additional money to cover additional staffing. I think we could look at, if I'm not mistaken, HMIS may be at a certain percentage. Is that correct, Taylor? Yeah, so, and I'm not sure if that's a guideline of DHCD or if that's a HUD guideline based on how we can use our money. So, you know, it's not out of the question, but I think we'll need to see as we start implementing this, what the additional staffing activities are that would need to be covered.
Hey, Andrea, this is Jordan.
Yep.
And I'm more so asking this for other people to hear the answer, but what can the providers in the COC, I know you already went over a slide of like next steps, but what can the providers in the COC expect to happen next that will require action on their part, and what should they be prepared to do or be preparing for in the meantime, if anything?
So I think one, making sure everyone has seen this presentation or is aware of this presentation and ask questions from this. So it's something that I believe COCs need to be bringing to their agenda, that this is something that is coming, and in order for us to participate, what do we need? Like I said, we can share documents that we have with, you know, big watermarks of draft and not approved yet on them. So if there's concerns with anything in that, we would be able to have discussions. And then, you know, like if you're doing something statewide, we're well aware that we're not going to please every single person. But if we can get it to a place where most of the people are good with it and other people can live with it, then that's kind of the place that we're trying to get. So it's really about starting to have conversations about it, how it can be used. At the beginning, when we implement it, there'll be we'll do a first stage of just a COC lead and an HMIS lead, getting access to their COC information. And then once everybody in the state has that level, then the next will come to projects. And then depending on their staffing capacity, we'll then, after projects have access to it, then the next step would be for care coordination.
Great, thank you.
Mm-hmm. Did I miss anything that you wanted me to add that you were thinking, Jordan?
No, I think that was perfect.
Okay, great. And at an agency level, you would be able to see the staff that are part of your agency. So if you wanted to do some of that information about, you know, where clients have been and things like that, to look through, you know, to work with your case managers on it, that could be done. But just the volume of case managers that could potentially have access, we've got to have a more robust capacity at DHCD. So if you are interested in seeing documents, or if, please let Elena know. If you send it to me, that's fine, but let Elena know, and she's going to keep track of where we send those out. So just so, you know, we can follow up to check to see if people have questions and stuff like that. Anything else? I do appreciate the questions. All right, if not, I'll give you your 9 minutes back. You guys have a great day.
Thank you all.
Thank you.